What's up, guys? Welcome back to another episode of Stronger TV. I'm Kiefer Lammi, here with Dan Pope. And last time we talked a little bit about knee pain and some of the exercises that bug it, or some of the causes of this and how we might modify it in training. Well, this is sort of a part 2 video where we're going to discuss a little bit more specifically about how we go about programming so that you can continue to train hard despite the injury.
Yeah.
Make sense?
I agree. Before you start, man, I really want to say this is the magic where people get better. Right? And I know not everyone here is going to be a physical therapist, but I think physical therapists need to learn more about this. What's the programming? How do I tweak and change things so someone can continue making progress and their pain goes down in the course of time? And the other flip side of the coin is that if you're a coach and you're writing some programming for someone with knee pain, you can still be so powerful and help this person so much if you understand some of these principles.
Sure. Yeah, and I think this is really important in terms of, just creating a game plan for someone where they feel comfortable that they're on a path to success, right?
Yep.
So for this example, we're talking about somebody that's, a strength sport athlete, or specifically maybe an Olympic weightlifter, right? So commonly you might see that their training programs look something like, starting with skill work, so snatch, for example, or clean and jerk, right? For however many sets. Followed up by strength work to support that, which usually comes in the way of a bunch of squatting. And then after that, they might do any sort of, accessory work, capacity work, general GPP type of stuff to fill the gaps in, okay? The problem is that if you're dealing with knee pain, especially stuff that's a little bit more serious or it's bugging you, that these things at the top of the pyramid become really challenging to do. So what we find is that, all right, well, I can't snatch heavy right now because, it hurts to squat deep and I can't catch heavy weights overhead, right? So we're gonna take that same sort of skill work and we're gonna say, no, you're not gonna stop doing this. We're gonna regress back and we're gonna find the highest order movement that you can still do, so you continue training your skill, you feel fresh, and that as you progress back on the spectrum, you can keep training hard, right? So if you're trying to snatch, maybe we jump back and we do stuff like powers, right? So you're not catching it in a squat, you don't have the same amount of stress on the knee like Dan talked about last episode, right? Maybe you're working on tempo or paused overhead squats, so you don't have to quite, catch that snatch, drop into the bottom and come back up aggressively. We're starting from the top, slowly lowering down, working with a load and a tempo that you can control that doesn't give you pain. Okay. Secondarily, then we're focused on the strength, right? So traditionally you see squatting, maybe like high bar squats, pretty high intensity, pretty high volume. Well, if you're having knee pain and that's bugging you, where do we go from there, right? So there's a lot of ways we can adjust this, and it depends a little bit on the severity of it, but we can adjust your range of motion, right? So maybe we're squatting to a box that limits your depth. You're not quite bottoming out and slamming out of the hole on that. Okay, we can play with tempos just the same way we would on something else. Slow eccentrics, adding a pause, maybe even a tempo on the concentric, trying to build stress in other ways other than intensity and loading, right? We can just change the load and or the reps or the volume in general, which I know, Dan, is something you talked about, right? Traditionally we say if you're doing triples, you think that's gonna be something that's 80, 85, 90% of your max, but maybe it's, doing sets of 8 or 10 that bugs you, 3s don't bug you. So if we stay in a low or moderate intensity range of, 60 to 70% for sets of 3 to 5, which really aren't that hard for that, that staying below that threshold is super helpful, right? Yeah. And then, go ahead.
I was just going to say, what you're saying right now, Kiefer, is this is very much an art or a dance, basically, right? Sure. That basically everyone that comes in is going to have a little different flavor of knee pain, right? So for some person, it's going to snatches or any sort of deep squatting is completely off the table, 100%, right? Sure. And for other people, they can kind of handle that bottom position, but if they go a little more slow or they use a pause or a tempo. So I think what you're saying is really powerful here. So you kind of see where that athlete is, and then from there you start developing a plan, right? Is that kind of?
Yeah, absolutely. Yeah. And then when all else fails, still talking about strength here, maybe you do something like a deadlift variation, right? Because if we're squatting, the overarching goal here is that we're building leg strength. And yes, I get that a high bar upright back squat is more specific maybe to Olympic lifting, but if you can't do that, well, let's do a deadlift, right? You're still gonna train your legs, probably a little bit more, your hamstrings and your glutes. You're gonna train your back and your trunk, right? And you're gonna keep that kind of feel for what it's like to pick up or move a heavy load. Mm-hmm. Right, which is something that you could benefit from anyway, even if you're not in pain.
Mm-hmm. Okay, agree.
And then this third thing is, I labeled it as capacity. You could talk about it as accessory work, volume, GPP, whatever you want to call it, right? But it's all the other things that we do in a training program. Okay, so particularly for somebody that's coming back from knee pain and that maybe can't do as much specific volume as they want, we love to fill in the gaps with doing more single leg work, right? So we're still training the quads, we're still getting some stress on the knee, but the overall load is much less. It's unilaterally loaded, so we can focus on something that might be a deficiency for you, right? Direct quad work, right? So maybe this is stuff like, sleds or some variations of single leg work that are really heavily quad focused, or, we're mixing in stuff like blood flow restriction, which you might talk a little bit more about. It's a way to get a lot of stress with a really low intensity.
Yeah.
And then we fill in the rest of the gaps here by, building more hip strength in 3 dimensions, right? Doing some more hamstring work so we've got a good balance between quad and hamstring strength, right?
Yeah.
What do you think, Dan?
I like it. I think, can you do your little analogy with the house thing right here? Because
Sure.
I think that's going to be really powerful, and we're going to allow us to talk about more stuff. Yeah.
I think the way that we try to explain this to our athletes and to other coaches, right, is that before you have an injury, especially for a higher level athlete, a lot of times what you see is that you might have an overall training volume that, say, looks like a bucket like this, right? And you've got a giant majority of it is coming from skill work and strength work. Right? And this is specific strength work. This is like your squatting that we're talking about. And then you got a little bit of kind of like this accessory stuff at the bottom. You don't put much of an emphasis on it. Honestly, for a lot of people, it's probably even smaller and it's like this, right? Well, when you get hurt and you can't do all this stuff that you spend the majority of your time doing, people feel lost. And so what happens is all of a sudden their bucket becomes a ton smaller, right? Because they can't do any of this stuff. So they don't know how to maintain that training volume, maintain that capacity while they're doing that. Well, our goal is to find a way for you to maintain the exact same or similar type of total work that you're doing in your training, right? We just alter where it's coming from. So instead of dropping down and doing less work overall, spending less time in the gym, getting less training effect, we say, no, I want to keep the exact same size bucket, but what we're going to do now is we're going to adjust this. And we're going to say, okay, in the beginning, your skill work plus your strength work is going to take a smaller portion, right? It just has to. We can't do as much of it. That's what's bugging you the most, right? But we're going to say, okay, I'm going to fill the gaps by doing as much possible accessory work as I can, that you continue to maintain a training effect, right? So here's our accessory stuff. And as we progress, our goal over time is that as you're feeling better and we're able to do more stuff, that we're slowly starting to change this percentage down and down and down until you get to the point where this skill and strength work is back to the proportion that you want it to be at.
Yeah. This is so important for a variety of reasons, and I'll try to remember these. I feel like I'm going to forget them all. But anyway, from a psychological perspective, this is an enormous win. So if you're an athlete and you love Olympic weightlifting or you love weight training in general, when you have knee pain or any sort of injury, you are super down, right? And you realize how little you can do. This feels terrible. Right? But if someone comes along and says, oh, knee pain, that's not a big deal, let's just do this, right? Let's keep your training volume the same. You're still training the same amount of time. When you finish each workout, you feel like you're working really hard, and all these movements are designed to work on your weaknesses. You're like, wow, this is amazing. All of a sudden, I went from being able to do nothing, being depressed, really upset, to, wow, I continue training. It's not that big a deal, and I'm going to keep betting over the course of time. This is huge. Yeah.
And the second thing I think, too, is like avoiding risk of future injury. Because what happens if you go with this approach is you go from doing a lot to all of a sudden you can't do very much, is that once you're feeling better, your inclination is, I got to jump right back to what I was doing. So you go from doing just this much to I'm going to do this much again.
Yeah.
And then that's one of the biggest things that causes future injury is these acute spikes up and down in your training volume. So you just yo-yo back and forth with the same sort of injuries over time instead of focusing on building up a foundation of all these other things we can do and slowly progressing back.
Yeah, keep that box up. It's funny, I was going to say the same exact thing, so it worked out.
Stole it from you.
Yeah, good. What I'd like to do next, Kiefer, and I'd like to hear your feedback for this, is I want to take two athletes, right?
Sure.
Let's say someone that has like a minor knee injury. It's not that bad, but they probably do need to tweak some stuff.
Sure.
Or let's say it's that athlete that has this chronic knee pain that kind of pops up from time to time if there's too much volume or intensity, something like that. So that'll be the first example. Someone with minor knee pain or like this kind of like floats in the background pain every once in a while. Mm-hmm. And then let's take someone who's really painful, that's like the very bottom, their knees are killing them, but they want to ultimately get back to like a snatch kind of example. Yeah.
All right.
Do you want, maybe I'll start with the basic one since that's kind of what I work with, the person that's like really, really painful. Yeah. So let's say you have an athlete and they hurt their knees are really aching them and they want to get back to, let's say, snatch, right? So in terms of skill work, we still want to work on the snatch as much as we can, but just keep in mind that bottom position of the squat is probably completely out because it just really hurts, right? A lot of times you can get away with doing a lot of power variations of the snatch and continue working that skill a little bit. We do have to be careful because sometimes even catching in this position here with a knee bent can bug people. And sometimes I'm actually having them do muscle snatch variations, right? The other thing is that if you pull from the floor, that's a decent amount of knee bend, and sometimes they can't even tolerate that.
Sure.
So sometimes what I'm doing is I'm doing a power from a hang position, or I'm doing a hang position muscle snatch, because that's really all they can tolerate. They're pretty limited, right?
So we kind of pick apart, all the different demands of the snatch, not just the squat and the knee bend that we're talking about, but the overhead position, right? The shoulder strength that it requires, and we're trying to fill those gaps as we can.
You got it. The other piece is that we're probably going to have to decrease the amount of volume and intensity here, right? So just keep in mind that your bucket is going to change some, and the focus is going to go away from this a little bit, but we're trying to maintain the snatch as much as we can, so we're going to be using some of these variations. Next is strength component, right? We don't want to lose our strength. We work so hard to build this. The thing is, that deep squat position just doesn't feel very good, for now anyway. So what we end up doing is trying to pick variations that feel great. So the thing is, something like a Romanian deadlift, right, is probably one of the most friendly exercises for the knee in terms of how much bend there is, how much quad is firing. Again, watch the prior episode if that's a little bit confusing. So if it's really bad, we can use some sort of deadlift variation, right? The other thing I like to try is a higher box, wide stance box squat. Usually that's tolerated pretty well for athletes. And again, we might have to mess around a little bit with the tempo, right, or the repetitions. Maybe I increase the repetitions, the load is not as much, right? So there's a few things we have to think about from that perspective, but at least we can maintain a little bit of snatching, which is good psychologically to maintain your strength, and also a little bit of the strength work here, right? I think where we get really fancy from the physical therapy side of things is this work here, which is funny because this is like the stuff that most people think is super boring, but I think is awesome because you can kind of still train a little bit, right? So if we're looking to get some direct quad work, a lot of times that's challenging because direct quad work tends to hurt the knee as well. So what I end up doing is giving things like terminal knee extensions, things like reverse sled drag, stuff that's pretty safe and easy on the knee but gets a lot of quad work. The other thing you already talked about is using BFR. So BFR is blood flow restriction training, right? And basically what blood flow restriction training does is it limits the amount of blood that leaves the area when you're training, and you fatigue faster. So you build up a lot of that acid feeling, that burning sensation. And because of that, you can get a training effect with less load, right? So if I'm trying to directly work the quad, but all quad stuff is painful, I can decrease that load, get a training effect, with something like blood flow restriction training, right? So now maybe you're doing 20 minutes worth of blood flow restriction training in your program, right? Whereas before, like that would never even be a thought just because you didn't need it necessarily, right? We can focus initially more on hip strengthening because we know that people with knee pain, if we focus on hip strengthening, their knee pain tends to go away. So we throw a lot of that extra stuff in there. And then I love doing a lot of single leg work, but again, modifying the positions, how deep you're going, and everything we talked about in the prior episode to continue strengthening without necessarily hurting things. Yeah. Do you have anything to add? Because I know we share a lot of patients that are really painful sometimes, and you take away like a lot of the programming for them.
No, I think this is great. I think it's just kind of what we almost have to do is you just flip this upside down, right? In terms of where your emphasis is, and we say this is going to be our biggest emphasis because these general exercises are going to have the least stress overall, right? And then as we kind of progress, whether it's weekly or monthly or what have you, right? That idea of how specific these things are to their goals starts to increase, and we do things that help get them back to that, right? So maybe, week one when we're able to do some squatting, it's just a light tempo box squat, right? And we're filling in the gaps with all the single leg work. Week 4, we might be starting to load it up, and they're getting to 60% of their max, which is still not that much for them, but they're doing a little bit more of it. So we might cut back a little bit more on some of this accessory stuff. And as the intensity and as the volume of the strength work starts to pick up, we just drop down how much of that accessory work we're doing, which is super similar to kind of like the lifespan of an athlete going from novice to more advanced, right? In the very beginning, your window of opportunity is super broad, right? So you take advantage of that by doing a ton of general physical preparation, not necessarily needing to worry about how much specific work you're doing because you're still going to get a training effect, you're still going to get stronger from the general work. As you get more advanced, those general exercises have less of an effect on you, and you need to do more specific stuff to get that training effect, right? So if you're coming back from injury, that's just, we treat it the exact same way.
Like it. I was going to ask, I think it's kind of intuitive, but do you want to go over, like, let's say, I think you're a good example as an athlete that's had a lot of knee pain. So it's certainly been very, very bad, but part of it is that it kind of tweaks from time to time. It gets better, it gets worse, and it kind of goes up and down a little bit. So how would you modify, let's say you're trying to get your snatch up, which I know you've done this in the past, right? And your knee is bugging you a little bit, right? But it's not that bad. And you can do all the lifts and it feels okay, but you have this kind of chronic, kind of irritated, nagging knee. How do you deal with that as opposed to a person that's really, really hurt?
I think it takes it takes a little bit of trial and error, unfortunately, right? And it takes a good understanding of like how you're feeling day to day and how you're feeling after sessions or for subsequent sessions and how you recover, right? So what I try to do best I can is, I start at like a lighter or more moderate intensity, right? And I'll do a really low volume. So I'll do 3 or 4 sets, right? Making sure that whatever variation I'm doing is the most advanced one that I can do, maintaining like below a 3 on the pain scale, right? Out of 10. Right, meaning like I might feel a little bit, but it's not that significant. It's just more of an annoyance, or it's something that I'm aware of as I go through, right? And then I want to know that night and the next day that intensity of the pain is either staying the same or hopefully getting a little bit better, but definitely not getting worse, right? And if I did, then that's a win, right? And the next week I'm going to try to progress. Usually, again, in terms of like adding 1 or 2 sets before I start to make it more difficult. I'm going to do the same thing with my strength work, right? Like I'm going to find the squat variation that's most stressful on my knees and my quads without causing pain to the area that I have injury, right? And I'm going to push that kind of as much as I can in terms of volume and intensity, staying below that 2 or 3 and making sure that the next day that I don't get sore. And sometimes I do, and I realize, all right, that was too much. I pushed a little bit too hard, right? And then I fill in the gaps where, depending on how much of this stuff I'm doing in a day, I might make a lot more of my accessory work hamstring related, right? Or if I'm taking a day off from this stuff because I was a little lit up and I decide I'm going to do deadlifts or trap bar deadlift or something that's less stressful, then I might fill in the gaps of doing more single leg work to get a training effect to my quads because I didn't feel good doing it that day with skill work.
Yeah. A lot of really good stuff there. One thing that I think you said that was really important for people to understand, I think it's a little bit of a misconception, is that when people have an injury, they're like, all right, I need to rest this away. I need to rest it to get rid of it, right? But we do know a lot of conditions, especially patellofemoral pain syndrome and some of the patellar tendinopathy and a lot of tendinopathies around the body, they tend not to get better unless we stress them. Right? So it's just thought of like, okay, my knee hurts. All right, I rest it. All right, it feels better. I go back. Oh, it still hurts, and they just have this like thought that they have a bum knee for the rest of their life that's never going to heal and get better.
Right.
In general, pushing the envelope is like the medicine that's going to help you get better. That's how I try to explain to people. So if you're keeping within those guidelines, so what Kiefer's saying is that he's trying to find the most stressful exercise that he can tolerate without going too far off the edge.
Right.
And part of that is that we want that high dosage of medicine to get better. It's just that we don't want too much. And the analogy I love is kind of like the aspirin analogy. If you take 2 aspirin, it's probably great for your pain. If you take the whole bottle, it's going to kill you. But it's not the aspirin's fault, right? It's the dosage.
Right.
So the same thing goes for a squat. Like if I'm doing my squats like this, like on my toes, this way, it's probably gonna blow my knees up and it's like taking the whole bottle of aspirin.
Right.
But if I'm doing like a high bar, sitting my hips back, and I'm tolerating it, maybe a little bit of pain, next day I'm feeling pretty good, that's probably just the right dosage. And over the course of time, we had to alter that. We had to change. We had to get a little bit more. So it's just this I call it art or dance. Like you're constantly trying to tweak and change these variables based on how you feel week to week and month to month. Yeah.
Of course. Yeah.
The last little thing, and I know you've heard me say this a lot, is that getting out of pain is kind of like trying to lose weight, right? So if you're trying to lose weight, a lot of times you'll go on the scale every single day and your weight just does this all the time and you're super frustrated with the whole process, right? Same thing with pain. A lot of times from day-to-day basis, it's up, it's down, it's up, it's down, and there seems to be no rhyme or reason to it, which is very frustrating and it feels like you're not making progress. A better way to lose weight and just be more objective about those results is to check your weight every 2 weeks or so, right? And then you say, okay, I actually lost 2 pounds. Then 2 weeks from there, all right, lost another 2 pounds. And I'm making progress from that perspective. Same thing goes with pain. You're gonna have a lot of ups and downs, and that's just part of the rehab process. But if from month to month you're making some solid progress, then that's really the main thing that we care about. As long as that's being fulfilled and you're tweaking these variables to make that happen, you're in the right, I guess.
I love it.
Yeah.
All right, I think we've exhausted this topic for today.
Oh yeah.
As always, guys, thank you for listening. If you like this episode, please share it with your friends, like the episode, leave a comment, and be sure to subscribe so you see future episodes.